Difference between Alport syndrome and nephrotic syndrome. Look at this picture, shows that Alport syndrome. It is a genetic disorder characterized by kidney disease, hearing loss, and eye abnormalities due to mutations in type 4 collagen. Nephrotic syndrome. It is a clinical condition marked by heavy proteinuria, edema, hypoalbuminemia, and hyperlipidemia, resulting from various underlying causes that damage the kidneys. Difference between one definition. Alport syndrome, a genetic disorder characterized by kidney disease, hearing loss, and eye abnormalities due to mutations in collagen type 4. Nephrotic syndrome, a clinical syndrome resulting from various underlying causes characterized by significant proteinuria, edema, hypoalbuminemia, and hyperlipidemia. To etiology, Alport syndrome primarily inherited in an X-linked pattern, but can also be autosomal recessive or dominant. Nephrotic syndrome can be caused by various factors including minimal change, disease, focal segmental glomerulosclerosis, diabetes, and infections. 3. Age of onset. Alport syndrome typically presents in childhood or adolescence, often between age 5 and 20. Nephrotic syndrome can occur at any age but is most common in children aged 2 to 6 years. For key symptoms, Alport syndrome, hematuria, blood in urine, progressive kidney failure, sensorineural hearing loss, and eye problems. Example, cataracts. Nephrotic syndrome, significant edema, swelling, proteinuria, large amount of protein in urine, and fatigue. 5. Urine analysis findings. Alport syndrome typically presents with hematuria and variable proteinuria. Nephrotic syndrome characterized by heavy proteinuria greater than 3.5 gram per day with little to no hematuria. 6. Kidney biopsy findings. Alport syndrome shows changes in glomerular basement membranes, thinning and splitting. Nephrotic syndrome varies depending on the underlying causes. minimal change disease shows no significant changes under light microscopy, while FSGS shows sclerosis. 7. Prognosis. Alport syndrome often lead to end stage renal disease ESRD by the second or third decade of life. Nephrotic syndrome, the cause varies widely. Some children may be outgrow the condition while others may progress to chronic kidney disease. 8. Inheritance pattern. Alport syndrome mostly X-linked recessive inheritance. Males are more severely affected. Nephrotic syndrome not inherited in a specific pattern, may be primary or secondary to other diseases. 9. Management. Alport syndrome focus on managing kidney function, monitoring hearing loss, and considering renal replacement therapy in advanced stages. Nephrotic syndrome involves corticosteroids, diuretics, and managing underlying conditions. Treatment aim to reduce proteinuria and edema. 10. Complications. Alport syndrome includes kidney failure, hearing loss, and potential ocular complications. Nephrotic syndrome risk of infections, thromboembolism, and cardiovascular issues due to loss of proteins. 11. Associated conditions. Alport syndrome associated with hearing loss and eye disorders. Nephrotic syndrome may be associated with infections, thromboembolic events, and metabolic disturbances. 12. Genetic distribution. Alport syndrome males are more frequently and severely affected. Nephrotic syndrome affects both genders, but certain type like minimal change disease are more common in boys. 13. Genetic testing. Alport syndrome genetic testing can identify mutations in collagen genes COL4A3, COL4A4, COL4A5. Nephrotic syndrome generally no specific genetic tests, but secondary causes may be investigated. 14. Prognosis. Alport syndrome prognosis is generally poor in males. Early diagnosis and treatment can help manage symptoms. Nephrotic syndrome prognosis varies widely. Many children achieve remission with appropriate treatment. 15. Long-term follow-up. Alport syndrome requires lifelong monitoring for kidney function and hearing. Nephrotic syndrome needs regular follow-up to monitor kidney function and manage complications. Thank you. Have a nice day.